showing to you on how we are doing the infant vital signs. So these are the things that we will need to do it. First, we need to have a digital thermometer, an infant stethoscope, a measuring tape, a weighing scale, and a watch. You need to make sure to wash your hands, wear your mask, and sanitize all the equipment before and after using. So we will start in checking our infant's respiration. So we need to assess the infant if there is a series of nasal flaring by checking the nose. So nasal flaring may be an indication of breathing difficulty or even respiratory distress in infant. Check for the airways obstruction and call a healthcare provider. Make sure the most reliable to measure the infant breathing is to count the number of infant's breath for 60 seconds. A person can gently place the hand on the baby's stomach or chest, counting each rise and fall of the abdomen as a single breath. So the normal breathing for infant ranges from 40 to 60 seconds. After the respiration, we will be checking the infant heart rate by using an infant stethoscope. So first, we need to locate the infant apical pulse. So we can locate the apical pulse of the infant on the fourth intercostal space on the left mid-clavicular line. So we will count it in full 1 minute by counting or tapping the finger along with the heartbeat. Okay, so the normal infant heart rate ranges from 100 to 190 per minute. So after the heartbeat, we will be checking the infant's temperature using our digital thermometer. So for infant, we will be using the axillary method or the underarm. And then first, we need to place the tip of the thermometer in the center of the armpit. And then tap the child's arm against the body. Leave the thermometer for a minute until you will hear the beep. And then remove the thermometer and read the temperature. Normal axillary or under the arm temperature ranges from 97.5 to 99.3 degrees Fahrenheit or 36.5 to 37.4 degrees Celsius. And now for the weight, we need to make sure to remove the infant's clothing and soiled diaper, which can add up to weight. To weigh the baby, and then record, document, and compare the last weight of the recorded weight of the baby for us to assess if the baby gained a right weight or the baby didn't gain the weight at all. And then after the weight, we need to check the baby's length. We need to remove the baby first. And then we need to put anything that we can mark later on for the head and the tail. We need to place the baby. We need to measure the head. We need to have someone to help us in measuring the length of the baby. Mark right here for the head, and then also for the heel, make sure that the leg is extended. Mark for the heel, and then after that, we will remove the baby, and then we will measure it using our tape measure in a centimeter. So, we'll measure it by centimeter. So, the normal length for the infant is from 18 to 22 inches. We'll bring back the baby and then we will measure the circumference of the head. So the normal circumference of the head ranges from 33 to 38 centimeter. So place the tape measure above the eyebrows and the most prominent part of the back of the head. Right, so this is how we do it, and then after this we need to record the measure. After the head, we will measure the chest. Now we will be measuring the baby's chest. So we will be using the nipple line as our guide. And for the normal infant chest circumference, it should be 1 to 2 centimeters less than the head. So now we're done checking our infant vital signs. We need to make sure that we are documenting every numbers that we are getting from our baby.